Hi, this is Pamela Wirth, and today I have Dr. Julie with me. Dr. Julie, it is such a pleasure to have you. You're a leading authority in patient safety, nurse educator, founder of Lifebeat Solutions, and you have over 40 years of experience in nursing practice, education, and executive leadership. Best-selling author, and recently spoke on the stage at TEDx. So welcome. Thank you for being here.
Thank you for having me. I'm really excited to talk to your audience.
So tell us a little bit about you, your journey, why you got into health and wellness, kind of what are you doing here to help people as they're trying to figure this all out as things are kind of changing and new information's coming out.
Yeah, so I was already a nurse for 30 years at the bedside, working in the ICU, working in the emergency department and trauma. And then I was on the helicopter for 10 years, which was really fun. That was in Las Vegas. But when I started into nursing education back in 2009, I started on my master's degree and then my doctoral degree for nursing. And found that medical mistakes were the third leading cause of death. And that really alarmed me because I was in the profession. How did I not know that? We didn't speak about it in, the hospital or the nursing world, the health world at all. So that, started my journey in doing this research. And what I found was quite shocking. And that's why I decided to write my book a couple of years ago because people are just not aware. And I think our culture is very based on passive recipients of healthcare. And I know the movement towards wellness is pretty new as well. But I think honestly, they go hand in hand. How can we keep ourselves in the most healthy condition? But if we go to the hospital or our loved ones, what is it that we need to know to be safe, and prevent any of those medical errors or mistakes that do occur?
So assuming you're going to outpatient surgery, inpatient, what are some of the questions that you should ask? What are some of the things that might be happening behind the scenes that for people that don't really understand medical health and wellness, anything that kind of is happening?
I would say the first thing you can do to be proactive if you're going to the hospital for a planned surgery, or even if you've got a condition that takes you to the hospital, whether it's emphysema or heart disease, is to look on a website called hospitalsafetygrades.org. And you can find, just by putting in your zip code, all the free information that is related to safety on that hospital. There are 22 categories of safety, and they're ranked red, yellow, green in each of those categories. But also, the hospital receives a letter grade, just like in high school or college, A, B, C, D, or F. Your chances of a bad outcome or dying of various reasons at a D-rated hospital versus an A is about 91% higher. So you can go in there and see, how does this hospital rank for healthcare acquired infections? How does this hospital rank for communication between doctors and nurses and patients? And it really is very informative.
And so what are some of the things that you now are focused on in terms of like, are there certain areas that have more problems than others? And where are you spending a lot of your focus?
Well, medication errors are the most common mistake made. Now, a lot of them don't have any effect at all, getting the wrong medication or the wrong dose. Some of them are very harmful and some can kill. So, understanding your medications is really important. But I think the factor that goes hand in hand with that is communication, because the Joint Commission, which is our agency, national agency that really gets into the healthcare settings in the hospitals and checks to see if they're doing things safely. They have said for quite a few years now that communication breakdown is the number one cause, and it's responsible for about 70% of patient harm. And so that is communication between the doctors and nurses themselves, or between the healthcare team and patients and their families, or patients and their families just don't think to say something like an allergy or a past medical history that may be really important for, what's going on today. So communication is so key.
And so are you spending most of your time talking with families and patients, or are you talking mostly with providers and hospitals or outpatient centers? Where are you spending a lot of your time now?
I really believe the problem is twofold. And so I split my time really between both consumers and the healthcare providers. And that's when I did my TEDx talk and it came out in January. That was the focus of really talking to both parties, in that healthcare providers need to listen, because when a patient or their family member says, I don't feel good, something is really wrong with me, or this is not like my mother. I know she's 75 years old, but she's never confused. What's going on? And so, really, that two-way communication and the listening from both parties is so essential, because who knows yourself or your family member better than you do? I mean, nurses, come in and out of the room and they're doing their tasks, and doctors come in, for a couple of minutes and then they're on to the next. But really, another tip I'll say is speaking up, but also keeping a journal. When you're in the hospital and the doctor comes in and says, okay, we're going to do an echocardiogram because we think your mom has congestive heart failure, write it down, but ask those questions. And then you can go research it a little bit too, so you have a better understanding. Because when you're informed and can get educated, that is when you can have, pardon me, the intelligent questions to say, but wait, if you're giving my mom a blood thinner after surgery, she already takes a blood thinner because of her irregular heart rhythm. Does she need both? And then that gives the provider a chance to say, oh, shoot, no, she doesn't need both. I missed that. And it really has to be a two-way communication. So I think the energies are equally distributed between healthcare providers and then patients and their families.
Yeah, no, I think that's a really good point too. I've been helping my mom through her cancer journey, and it
Mm,
started. She had 90 days to live almost 7 years ago. She's doing great, but it started when she started going to the doctor saying, "I don't feel right," and it took them over a year to finally listen to her and say, "Okay, fine. We'll do um, an ultrasound." Was what they ended up finding it, and not a super expensive test. Probably could have been found a lot sooner, and her cancer probably would not have been quite as
mm.
spread. But what I'm finding with her is it's so important, back to your journal entries, to kind of keep track of all of this, because when she hears information, she doesn't hear it all the way because she's worried. Um, when my dad hears the information, he doesn't hear anything at all. Because he's just not, he's so detail oriented in some things, but not in that. And so you really need to find an advocate with you when you're going through things. And I don't know that um, I don't know that they necessarily help people through that enough to say, hey, who is with you and can we talk with them? And sometimes my mom will get mad at me because she'll say, well, why are they talking to you and not to me? And or she's like, well, they have eye contact with you and not with me. And I was like, Mom, you have to remember, like, I'm absorbing the information differently than you are. And it's the communication piece is a really hard thing inside the patient, inside the family, inside the practitioner. They don't have enough time to deal with everyone.
Right.
Um, and how do you really take care of everyone, and document everything in a way that is safe and not scary too.
Yeah, it is difficult. I mean, medical jargon is like a foreign language.
Mhm.
They use terms that the general population don't know or aren't aware of, and probably don't even know how to spell it to even write it down and look it up later. But I think that also is why it's so important to have that open communication as good as we can from both sides. But the other thing I'll add to that is when there's a diagnostic exam done, whether it's a lab result or a lab test or a CAT scan or, even a biopsy, is make sure you follow up. Don't assume that just because you didn't hear back from your doctor that it's normal, because there's too many cases where the report was misfiled or they forgot to flag it or the doctor forgot to follow up with the patient, with whatever detail. So just as again, taking ownership of your health, make sure you follow up. A lot of it can be found in your, portal, patient portal, but call until you ask for a copy of the results.
Yeah, well, it's kind of interesting too, and having, kind of going back to my mom, in her patient portal, it's one of these larger national organizations where she gets her diagnostics, and they have two readings available. One that's kind of like a simple person way to read it, and then a more diagnostic type. Um, but it's interesting if you take the diagnostic and then you ask a different practitioner, or even if you put it into Chat GPT and ask it to give you what's happening here, it is very different in terms of um, what it's saying to you. Um, and so I think there's still a long way to go in terms of how, and it kind of depends on the person too. Does the person really want all the information or not? Some people really don't want to know. Um,
Right. They want the simple version.
yeah, yeah.
Yeah.
So. So tell us now, your program, your book, your TEDx talk. Tell us a little bit about those.
Yeah, so the nursing courses that I developed over this last 18 months, I did that because I'm still a nurse educator and I see that we can't teach it all and the students can't absorb it all. And there are things that nurses miss that are really pertinent to patient safety. For example, what I did my doctoral research on was something called failure to rescue. And that is when the nurse, and we say the nurse because who's at the bedside for 12 hours in the acute care setting, right? It's not the doctors. But when the nurse misses early signs of deterioration, and that could prevent a patient from deteriorating further and either going to the ICU or going into cardiac arrest, that was a big opportunity or a gap in knowledge that I felt was really important to close that gap. But I also share those things with patients and their families, like on my social media, my TikTok and my Instagram, et cetera, is here's a normal range of vital signs, and you can, look those up. AI is great. We'll talk about that more in just a minute. But just say, what's the normal heart rate for, a 70-year-old woman? And medications can affect that, of course. But if their heart rate is high, then what could be the reasons for this? And it really is putting those pieces together to kind of paint the clinical picture. So I just, re-educating nurses to make sure that things are not slipping through the cracks was really important to me because that's going to be key to preventing patients from getting sicker. And the interesting thing is those physiological signs of change that can indicate deterioration occur 6 to 24 hours prior to a cardiac arrest. So there's time. If the blood pressure is falling, and again, we can look at trends, or the heart rate's increasing, the respiratory rate's increasing, those should be clues that we need to have more vigilance and checking in on that patient. So in my book, I just try to educate too. Here's what you should watch for. Here's questions you should ask. It can't cover it all, of course, but at least it will get people thinking. There is 30 stories in the book. Unfortunately, they're all true, and most of them didn't end well. But again, I think people relate to stories, and if they read it and say, oh my gosh, that happened to this person, now I know what to watch for. The other thing, like you brought up my TEDx talk, what I talk about is why communication is so essential. And I give 3 stories in there, patient stories. I did ask their families permission to share their stories. And of course, they want people to learn, from their tragedies. But the biggest take home to me if I could communicate and give all these teams, but especially patients and their families, the courage to speak up, because I know it takes a lot of courage. Well, that doctor's had 12 years of training, and that nurse has had 2 or 3 or 4 or 6 years of training. Who am I? I'm just a layperson. I don't know anything. I'm just going to trust. But if we feel, and I say gut intuition is so important, if we feel something's not right or we just need further understanding, it's your right to ask, and you should. Because again, it may be that little clue to say, oh, your mom's not normally confused. Let's figure out why. And so the courage to speak up may make the difference between life and death. And I know that sounds histrionics, maybe, but there's plenty of examples of that out in the literature in my books and other, case studies.
Excellent. And then maybe touch on too, what types of nurses do you work with? And I don't think most people realize this, but there's actually a lot of different kinds of nurses.
There is. I've done quite a few different things over my career. I've been in nursing education now 16 years. Um, but a lot of what I talk to, or a lot of the audience that I talk to for nurses work in the acute care.
Mm.
Long-term care, they're pretty stable. They need to get their medications and be turned to make sure they don't get pressure ulcers or bed sores.
Mhm.
But things in the acute care can happen really fast because patients are sicker. Patients are going home after what I used to consider pretty big surgeries like knee replacements or hip replacements within a day. And so there's a lot involved in sending that patient home, a lot of patient and family education. Yes, I guess my point is the acute care setting, they are quite sick. Once they become a little bit stable, they're sent home. So, yeah, home care nurses obviously need to help families learn what to watch for as well. Um, but like we said in the very beginning, I think understanding how to keep your health as strong as you can for as long as you can. And I know we've all heard it. Watch what you eat, get out there and walk, even if it's just walking, but especially as we age, so we don't lose the muscle mass, lifting some weights. It really is a holistic approach to making sure we stay as far of the healthcare system as we can, as long as we can, because it's not healthcare, it's disease care. Healthcare is more of what you do.
Yes, it is trying to be proactive as much as we can before we actually get sick, I think is the most important thing. And just because you're sick doesn't necessarily mean you need to do something radical. Sometimes you
Right.
just need to figure out what's causing that symptom and see if you can't undo that. So, anything else you want to touch on? Anyone else that you really want to speak to?
I would say don't be afraid of AI.
Mhm.
People used to use Google as their go-to for research. And I do know there's a little bit of challenge sometimes with ChatGPT or whatever. They call it hallucinations. It can be a little, off, but there's several free ones that you can use. Gemini's got one with Google, ChatGPT, of course, and others that are free. But put in your questions, put in your symptoms, put in, just say, hey, I just had hip surgery. My doctor sent me home with these medications. I know one's a blood thinner. What should I do? What should I watch for? What should I be careful of? I mean, this should be discharge instructions, when you go home from the facility, but you're never going to remember it all. As you said, the patient has got anxiety, maybe they're in pain, maybe they're sleep deprived, but just start getting into the habit of asking questions that you can find answers to. I think it's so helpful to just elevate your own education about your own body, your own health, your own, journey.
Well, and one thing I'll add about AI, and I haven't learned this myself and I coach others on it, is you need to ask it a half a dozen different questions. You really need to frame it. I'm a X um, years old, and give it a lot of background.
Yes.
Otherwise, the answers vary differently. Um,
Yes. Agreed.
it's, that's one of the things. And then just kind of continuing to ask it to think a little bit further and a little bit further. And then finally, you can start to trust your gut that you've got the right answer. Um, but I think it's a super powerful tool, and I think it's going to change a lot of what we're doing and how we interpret information and communicate. And um, my hope is that it helps people along the way.
I do too. We used to rely on the healthcare team, our doctors. Like my mom years ago, I know it was the doctor's word was gospel, so to speak, but they're so busy now and healthcare's changed so much. And here's the thing, medical knowledge doubles. I think several years ago, it was, I mean, so fast, and it's even faster now. And so it's not that your doctor may be negligent, but they may not be able to keep up on your particular case, diagnosis, health history, whatever. And the right doctor, when you bring them, hey, I learned and read about this, what do you think? Would be open to say, yeah, let's discuss that. If they dismiss you, that's when I would, go find another provider because they can't be the end all be all for
Yeah,
us.
no,
We
not
need to be
anymore.
that.
Not anymore for sure. It definitely takes a team.
Yes.
If people want to learn more about you, your book, where can they find you?
My website and all my socials are drjuliesiemers.com for the website. But yeah, on TikTok, it's Dr. Julie Siemers. I think I've got over 300 videos now that I just try to inform, educate. But yeah, happy to answer any questions or, they can book an appointment with me if they want to learn more. But I'm just here to elevate the safety and the health of as many individuals as I can impact.
Wonderful. Thank you so much, Doctor.
Thank you. Appreciate it.